Hello, my name is Kira Johnson. I'm an AmeriCorps Vista at the Famicos Foundation, and this is the Famicos podcast. Just in general, the mission of the Famicos Foundation is to improve the quality of life in the greater Cleveland area through their neighborhood revitalization, affordable housing, and also the integrated services that they provide. If you are wanting to contact the Famicos Foundation, we're located at 1325 Ansel Road. Our phone number is 216-791-6476. And you could also go online to famicos.org for more information or to contact us. Now, some events and announcements that are going on with Famicos right now. The farmers market, the season just closed for that. Thank you all for a great season. We'll see you next year, and make sure that you check our social medias. If you check those, you can see some virtual cooking lessons with Chef Sherelle. And also, we are having a food distribution on Thursday, January 27th, and it's going to be at the Huff Multipurpose Center, and that's located at 8555 Huff Avenue, and that's going to be from 10 a.m. to 1 p.m. We also are going to have a vaccine clinic, and that's going to be at the Famicos Foundation headquarters, which is, again, 1325 Ansel Road, and that's going to be on January 31st at 11 a.m., and they will only be having the Moderna vaccine there. Another thing in the news is that tax season is here. If you're wanting to have your taxes done stress-free and also right, you'll want to check out Famicos. You can call 211 and make an appointment, and they can do your taxes there for you. Another thing, if you're struggling to make ends meet with how prices are going up and continuing to go up, you can call our Home Ownership Resource Center, and they offer free financial coaching, credit repair, and also rental assistance. And that phone number is 216-791-6476. Or you could also visit our website, which is famicos.org. Now, as I turn to my guests this morning, I have with me today Tiffany Stately and Linda Kimball, and they're from Motev. And we're going to be discussing Motev and also COVID-19 and the COVID-19 vaccine. So just to start off, could you all say what Motev is and kind of give us some more information about that?
Cleveland Motev stands for Minority Organ Tissue Transplant Education Program, and we've been in existence for 27 years. We've been doing the work in our community to increase the number of people who are organ, eye, and tissue donors in the minority community through health education and promotion. We've been working on this for a long, long time. And because of COVID, we've made a decision, because of COVID-19 and the pandemic, we made a decision that we needed to expand our programming. And Tiffany's going to talk more about that. But we're housed at Centers for Dialysis Care, and we are actually affiliated with and sponsored and actually greatly supported by Centers for Dialysis Care.
Thank you. Yeah. And Tiffany, did you have more information about that specifically?
Further into what we do when we get into our roles.
Yeah. And I could tell you more about what Cleveland Motev does specifically.
Yeah.
So as I was saying before, not only do we talk about, we do have programming about organ, eye, and tissue donation. And some of that programming is that we go out in the community and we try and raise awareness about the importance of being an organ, eye, and tissue donor. Okay. We sign people up to become organ donors at outreach events. And we also have one of our signature programs is that we partner with the Kidney Foundation of Ohio. It's called our Healthy Teens, Healthy Tomorrow Teen Summit. We think it's important, especially with young people, to start them off young as possible, talking about prevention methods in order for them to start thinking about being as healthy as possible, taking care of their body and everything.
Yeah.
So we spend a whole day with them. Talking about chronic diseases, talk about being exercising and everything. And we've been doing this for close to 18 years with the Cleveland Metropolitan School District and surrounding schools, also suburban schools too. And this has been very successful with our programming and everything. And a lot of word of mouth with our neighborhoods as far as getting people to sign up to become organ donors. So this has been in existence for a very long time, and we're excited that we're going to continue this work. Even though we've been doing our teen summits virtually because of COVID-19, we continue to do this, talk to teens about the importance of being an organ donor.
And why would you say that organ donation and tissue donation is important?
It's so important, especially in the minority community, because we as a whole have a prevalence of certain diseases such as high blood pressure and diabetes, which causes organ failure. And we are on the actual waiting list more so than our white counterpart, which means that we need to get the word out about the importance of signing up to become an organ donor. And we match better with our own race than other races. So we need to actually get more education about the importance of signing up. We need to get the education out about prevention, education, eating better, etc.
Thank you.
I personally have had experience. I worked for University Hospital on the transplant unit, liver and kidney, and to see patients wait for that organ and to receive it and recover and, you know, get that second chance on life, it is just, to see that other end of it, it is just you can't even explain it. Even the African American, or just seeing what they go through, you know, adjusting to it, waiting for it, it just takes a toll on families. So to be on this end of it now outside in the community, now that I've seen it from the hospital end, you know, now having a voice of importance of donation is very important to me.
Yeah. I'm, like I said before, Cleveland Motev is housed at the dialysis center, the Centers for Dialysis Care, and I see every day the patients that this actually affects, the need for organ, eye, and tissue donation. And it's just so important that you get to see the people every day just waiting for the kidneys and everything, not only waiting for the other organs, but there's more prevalence of people actually waiting for kidneys than any other organ. And so the majority of the people that we see in our waiting area, of course, are minorities. So it's just so important that people out there, if you're not an organ donor, please learn more about, educate yourself about the need and everything, and please consider signing up to become an organ donor. That's why we're out there. That's why our community educators out there signing up people to become organ donors. That's why we have our Teen Summit, so we can start them off as early as young as possible, thinking about it, signing up to become an organ donor. Yes.
And what do you all specifically, like, what are each of your roles at Motev?
I am the executive director. Been the executive director for 10 years. I love what I do, and one of the reasons why I love what I do is because I feel that I make a difference in our community. I write grants. I supervise our program coordinator, our advisory board. I actually go out in the community myself. That's one of my joys, is to continue to go out in the community and actually talk to people. And educate people. I actually go to meetings with our other community partners, such as Famiko's Foundation, so I can understand exactly how I can actually collaborate with other partners to get the word out about our missions and to continue the work that we've been doing for 27 plus years with Cleveland Motev. Yes.
And I am the program coordinator. I am new to the team. I've been with the program now 3 months. I've come from the hospital environment, and it was so important to me. I came into it, I wanted something with a purpose. I felt like working through the pandemic was such a reactive environment. Every day I came into work, hospital beds filled up, and you're just trying to discharge patients with nowhere to go, where we're discharging them to. And it just was just a stressful environment, and I wanted more. I saw this opportunity, had a brother that passed away. He was on dialysis. This opportunity fell into my lap, and it gave me a purpose to get out in the community.
Yeah.
I love talking to people. It's like talking to my family. You know, I'm approachable. I look at them as I'm talking to an aunt, uncle, cousin. They're like me. Mm-hmm. Sometimes they approach me, you know, and I want that to be a open feel. Mm-hmm. And so, you know, I do vaccine education and outreach. I oversee 3 vaccine navigators. We do the pop-up vaccine clinics where we do the one-on-one. I love being one-on-one with people in the community that have the hesitation about vaccination, where you can share your story to say, it's okay. I was once hesitant about being vaccinated. Let's talk about the side effects. Let's just talk about what are you hesitant for. Let's talk about why are you hesitant. Let's talk about some of the things that, you know, you're concerned. So you have that advantage when we're at these pop-up clinics, especially at the Huff Multi-Purpose Center, where they're doing the food distribution, just meeting the community right where they are. Mm-hmm. The community is not going to their primary care physician. We have to create the trust in the community. Mm-hmm. And our vaccine navigators, we could hold their hand and rub their back and tell them it's okay, we did it, you could do it too. Mm-hmm. Do you have underlying health conditions? We want you safe. Joke. Yeah. It's no joke, we want you safe.
Yeah. Mm-hmm. And kind of going back to when we were talking about like organ donation, how can someone become an organ donor? Like, what would they need to do?
When you actually go to the BMV, one of the questions they'll ask is, or you can actually register online at registerme.org, or you can visit our actual website on clevelandmotev.org. There's many ways that you can actually sign up to become an organ donor. We suggest you do it online. You can be very specific of what organs you want to donate. If you have a kind of issue with actually donating your corneas and you just want to donate your other organs or your other tissues, you can be very, very specific. A lot of people don't know that. So I would suggest go online, registerme.org, or go and visit our actual website and actually register to become an organ donor.
Okay.
And what I do suggest and what I recommend is you share that information with your family members. Mm-hmm. Make sure your family members know that you made that decision. Mm-hmm. Yes.
Thank you.
Mm-hmm.
And so I want to transition into talking about the COVID-19 vaccine and getting vaccinated. And even just in looking at the vaccination rates and those numbers, like in non-suburban areas, there's actually a 43% versus 88% in the suburbs. And even in Huff, it has the highest number of COVID-19 deaths in the city of Cleveland. And just like, why do you all think that vaccination rates are so much lower in our East Side neighborhoods?
Yeah. When I saw that article, it really saddened me. It didn't surprise me. It really saddened me, though, because this is one of the reasons why I started my career in community health, is because I wanted to improve the quality of health in communities such as Huff. Mm-hmm. And that's one of the reasons why we received monies from CDC Foundation, because we wanted to actually get our community, our vaccine navigators out there and get the shots in people and everything, the vaccines and everything. One of the reasons why is there's so much misinformation out there. And that's why we have our vaccine navigators out there to get the correct information out to people. Mm-hmm. There is a lot of mistrust, and Tiffany kind of touched on there. There's a lot of distrust out there, especially in the minority community, for government, the medical community and everything, that we have to continue to talk to people one-on-one about the importance of the vaccines. People are getting information about that you get the actual vaccine, you're going to turn into a zombie. I'm serious. This is serious information that people are getting. So that's why we have billboards out there. We're We're doing podcasts with you guys. Famicos Foundation is doing the work. We're partner with organizations like yourself. Our actual navigators out there doing the work, talking to people and everything. There's a lot of misinformation out there that we have to educate people. Educate. And then, like I said before, that there is that mistrust, that's distrust that's been out there for years.
Yeah.
This hasn't just started, just because of the pandemic. This is because of the actual Tuskegee syphilis study and everything. So it continues on, and people continue to have the distrust. And the only way we can actually stop the distrust is actually having people talk about it. We can't just, sweep it under the floor and say, hey, you have to stop. We have to stop the distrust. We have to continue to talk about it and educate people with the correct information.
Yeah.
Yes.
And as Linda said, also we have signs in the bus stops. It's so hard. We have tables set up at the pop-up clinics. They're not taking the information. We sometimes have to refer to the information when we're talking to them. They want to hear one-on-one. They want to hear your story.
Yeah.
Because really what they're hearing is from others. They're hearing from the news, and then that information gets misconstrued, and by the time it gets to the 10th person, the story had been changed 10 times.
Yeah.
And so, you want to talk to and say, you stop and you say, let's talk about your situation. Tell me about your household. Do you have an elderly that you live with? Do you have underlying health conditions? You make it personal. So you can just nip the misinformation in the bud and make it personal to them. It's safe, it's effective. I tell them I came from the hospital. I worked a full-time job. I do this part-time because I care about my community. My maiden name is Huff, Huff, so Huff is dear to me. That just being there feels like family.
Yeah.
And so I tell them what I've seen. I tell them how the intensive care unit looks. I tell them that intensive care unit is filled with unvaccinated patients. My coworkers are burnt out. I came out of the healthcare system because I was burnt out, because of loss. And I just had to be a voice in the community. I had to. And so, a side effect from a shot versus being on a ventilator, I have to paint the picture. I also have to tell them that on top of COVID, people are still facing trauma. They're facing heart attacks. They're facing strokes. And the hospital is full.
Yeah.
Then you have the healthcare workers. They're burnt out. They're getting sick. Staff shortages. Surgeries being canceled. So it's a snowball effect. And it's just, this is important. We want you safe. We want your family, your household safe. So you start by making a decision for you to protect your family. I also tell them the importance of once you're vaccinated, it doesn't stop there. We stop wearing these masks. They stop wearing the masks. They think the vaccination and no mask wearing, and then the big gatherings with no mask, we can't stop there. So we got to continue to talk about that as well.
Yeah. And I know you all touched on it a little bit, like misinformation and also distrust within the healthcare system. What would you say are some of the causes and effects of having the lower vaccine rates because of those things?
It still kind of goes into hospital beds being full at capacity, sick communities, one person gets sick, it spreads to a family member, a neighbor. You're going out to the grocery store, then your community gets sick. It just spreads, especially around the holiday time. Oh, Thanksgiving, Christmas, you could forget about it. If you wasn't preventative, it was a mess. It definitely had a cause and effect. The hospitals were definitely struggled around that holiday time.
Yeah. And what would you all say that Motev is doing to help people become vaccinated? I know you all talked a little bit about it, but if you could elaborate maybe a little.
Yeah. So, as Tiffany said, 3 months ago, she got hired with Cleveland Motev. We received funding from the Centers for Disease Control, and we were able to actually hire Tiffany as our program coordinator and 3 actual vaccine educators to go out and actually talk to people about the importance about the vaccine, to increase confidence in the vaccine. We were able to purchase billboards, bus signs, etc., purchase educational materials. But I think the most important thing was actually to get the people out in the streets talking about the vaccine and everything. And we were able to partner with other organizations and to actually build awareness and get shots. I keep on saying shots into people, but you know what I'm talking about.
Yeah.
Vaccines into people and everything to actually make our communities as safe as possible. So we've been doing a lot of various things, but I think the most important thing we've been doing is we're out in the community. We like I said before, we were saddened by the actual story about Huff having the most people in a community actually dying from COVID-19.
Yeah.
We want to continue the work that we're doing so we can have less people dying in a community such as Huff and everything. So we those are some of the things. Some of our majority of our billboards are in Huff. The majority of the work that we've been doing have been in Huff, so we want to continue the work that we're doing. So some of those are some of the things that we've been doing.
Okay. And could you talk a little bit about vaccine ambassadors and what they do in the community?
Yeah, so our 3 navigators, when we have outreach events scheduled, the pop-up clinics, sometimes we have events that happen on the same day, and you know, with us having 3, it was one time where we had a huge mass event where all hands on deck. Linda and I sometimes have to step in, where depending on how long the event is and if it's a big event, our vaccine, we call them vaccine navigators, but they pass out, they set up a table. It has brochures, some Reno-friendly candy, you know, nice little handouts to make it approachable, where people are comfortable to come and get information. Typically, our biggest, we have either pop-up clinics where vaccinations are given, or we're at a pop-up clinic that's tied in with a food distribution. Those are very, very successful because you can reach someone that wasn't coming to get a vaccination, but they were coming to get food.
Yeah.
And you could talk to them about some of their hesitation or if they're vaccinated or not. But I reach out to our navigators to schedule them for those events by talking with our community partners and getting these events scheduled to make sure that we're there, passing out T-shirts and information, and just really making sure that, you know, we make the community proud that the decision that they made is a good decision, that they made it for themselves, their family, and the community.
We also always have, on our website, we always have Facebook messaging also. We also purchase yard signs, raise awareness about the importance of not only the COVID-19 vaccine, but also the influenza vaccine also.
Okay.
So those are on at all of the Centers for Dialysis Care sites and everything, facilities too. So we hope to have those yard signs at other different facilities also. But the messaging is really important, so we utilize social media a lot to get the word out about the vaccines also.
Okay.
And one other big push that we did right after Thanksgiving in November, if I was being proactive in my wisdom coming from the hospital, we worked with the Cleveland Public Health Department and getting COVID-19 testing kits before it became a supply and demand issue, and was passing those out to some of the community members that were hesitant about getting vaccinated. Well, if you're not going to be vaccinated, then let's test you and keep you safe over the holiday.
Yeah.
You know, Linda and I were at an event where people had to come get vaccinated, or they weren't invited to holiday dinner. They couldn't go to grandma's house without that vaccination. So, you know, testing was, I feel, a big awareness before it became a big deal on the news where testing, you know, wasn't available, but now it's becoming more available for schools, and now you can get it through the mail by ordering it. So, like I said, I've always come with a proactive instead of the reactive approach, especially before holidays. That I knew Thanksgiving would have been one thing, but Christmas was very, very dangerous if you didn't learn from Thanksgiving.
Yeah.
We are also in the process, Cleveland Motev, of partnering with Minority Health Alliance and hosting a upcoming webinar. And we'll be giving more information to Famiko's Foundation about that. And that should be coming up probably within a month or so.
Okay.
So we want to do more education, not only with our community members, but with people who are with our talking to community members, also health professionals too.
Yeah.
The most updated information as possible, because as you well know, things are changing. We got all these different variants and everything. Things are changing day by day. So we want the healthcare professionals to have the most updated information as possible. So we're in the process of doing that.
Okay. And there was actually a recent article that was about Stephen A. Smith, who he was speaking out. He's a former basketball player and ESPN sports commentator, and he was speaking out about his experience with contracting COVID-19. And he said that he became extremely sick, and his doctors told him that if he had not been vaccinated, then he would have died. Why do you think that getting the COVID-19 vaccine is important?
Is so important that in the recent, I would say probably within a month, I've had friends and family members that have had breakthrough COVID-19, and a couple of my friends have actually got like asthma or problems with their respiratory systems, and they've had breakthrough COVID-19 in very mild cases, but they were fully vaccinated, even had boosters, and very mild. But if they were not vaccinated, I would hazard a guess, and they even told me this, that they probably would have been on a ventilator and everything. It's so important. A lot of people think, I'm just going to get it. I'm just going to get it. You know, I'm just going to let myself just get it and just let it, you know, without getting vaccinated and everything. I think that's the wrong way to actually think about it. You need to be vaccinated. I have underlying medical condition, but I'm fully vaccinated, boosted. Give me all the vaccines in the world, because I don't know what would happen to me if I was to get COVID-19, and I'm not going to risk, you know, getting COVID-19 without having being fully vaccinated and everything. I don't think anybody should risk that. You might think you're the healthiest person in the world and everything. You don't know how COVID-19 is going to affect you. So you need to get the vaccine, and if you're eligible, get the booster and everything. I have a young niece. She's 33 years old. It took her a long time to get the vaccine. Now she's like, give me that booster now. She wanted to be as safe as possible, because she wants her community to be as safe as possible, and she wants to be around her actual family members too. So yes,
I have to say the same thing, where I've lost track between Thanksgiving and December. It just seemed like, you know, before you hear about people having COVID, but now the numbers have become so overwhelming, where it's been friends or people that you know that contracted COVID and spread it in their household, that you just lost track. And you know, thankfully, you know, most were vaccinated, or Some of them, it was just too late that thought about, being vaccinated. I myself, when I was hesitant, because some people, now they want that booster, you have to wait now 5 months. It was 6 months, but some of them, they're so scared, they want that booster right away, but you got to wait that 5 months after that second dose. But I was hesitant until my childhood asthma returned in April of and that's where my hesitation exited. And I have underlying health conditions with high blood pressure. You just don't want to play with it. You don't want to play with it. And I thought about it. I said, if I would have delayed it any more when Omicron came, oh no. So, I'm boosted, like Linda said, too. We both got our booster on the same day. That's the other thing in the community of being able to talk about mixing your booster. I had the Pfizer dose 1 and 2, but my booster was Moderna. That's a big concern sometimes with some hesitancy. Some people will walk away and won't get their booster because they're concerned about mixing it. And that's actually safe to do as well. So we get a lot of that at our vaccination pop-ups because of sometimes Moderna is the only booster that's available. But the unvaccinated is playing Russian roulette. It's just not safe.
Yeah. And I know it can be hard to sort through information and know what is true or what is false regarding information with COVID-19 and the vaccine. What recommendations or suggestions do you have for people who are trying to understand what is factual or what isn't?
I think if they have a really good relationship with their primary care physician, that's important. What's really funny is that I actually saw one of my doctors today, and of course I had my shirt on, and she was like, wow, that's great. Now, what should I be telling my patients? Because I told her that the reason why I had the shirt on is because, part of my job was to increase confidence in the vaccines with primarily the minority community. And her eyes just kind of lit up, and she said, what should I be telling my patients and everything? So I gave her some pointers and everything. So I think some of these doctors are want this information. They kind of are like sponges. What should I be doing and everything? So that's another audience that we should be talking to, because a lot of patients still are, even though what we just said something about the distrust and everything, we can probably kind of get information to some of the primary care physicians that look like them. So that's one of the things. If I think it's easier for people of color to actually kind of take in information from doctors that look like them and everything. So that's one of the things, is that if you one of the ways to actually get information from their primary care physician. I wouldn't say always go online, because sometimes you can get some bad information online, but also maybe go online. If you do go online, go to a source that you trust, which would be the Centers for Disease Control. Centers for Disease Control. Any other suggestions besides your primary care physician, if they're a trusted source for you, and also the Centers for Disease Control?
Those are my main two sources. I trust my doctor and the CDC.
Yes.
Okay. And what would then be some conversation pointers that people could use in talking to friends and family who have concerns about getting the shot?
I typically tell people to listen more than talk. Listen to see what the concerns are, because you could talk at people and miss what they're even concerned about. Let them talk, because sometimes they say, my first event in this role, it was a person in the community that said she wasn't getting it. Oh no, I'm not getting it. That shot made too many people sick. and it turned out to be possibly a person sick. And I said, what happened to that person? Talk to me about it. And it was just like a headache or a sore arm. So, you just kind of just unfold the story a little bit and just talk through it. And a lot of times it's not even the reading, it's just what they heard. A lot of word of mouth. Word of mouth travels faster than something they read or, heard. And like I said, by the time it gets to the 10th person, it's far from whatever they heard. And, information does change. The pandemic, has changed. We're 2 years into it.
Yeah.
And so we just reassure them that, we trust the wisdom that science and our physicians, and I really, really, really use my hospital experience of what I've seen, and that I'm vaccinated.
And I truly agree with what Tiffany said. I think the hardest thing for a person to do is to listen to other person. It's just almost like it's in us to actually just start talking when another person is talking, but from me actually doing what I've been doing for so many years, talking about organ, eye, and tissue donation and everything, just listen to another person talking and finding out the reason why they don't want to become an organ, eye, and tissue donor, or they don't want to get a vaccine, and then just talking and hearing their story and them realizing that you care about their story is one of the things that's really the most important thing. Hearing their story.
Yeah. With like hearing those people's stories, do you have any any tough conversations that you've had to have that you like with people out in the community that you'd like to share or just talk about?
Yeah, I saved mine for last. Is this the last? I say I have an unfortunate, circumstance that happened, but I like to talk when I'm in the community. I usually like to talk to them about, do they know someone that has contracted COVID? Have they lost anyone to COVID? Because, until the holiday, I hadn't lost anyone to COVID. My brother passed with pneumonia, which is, close to it, but losing someone during the pandemic is stressful. But, unfortunately, I did lose 2 family members that were unvaccinated. I personally did not get a chance to ask them their hesitation, so I can't really speak to, why they weren't, but the conversations were had about getting vaccinated. I do know that. My uncle, he was a liver transplant survivor. My aunt had sarcoidosis. Definitely 2 that definitely needed that vaccination. My uncle passed on Christmas Eve. My aunt passed on New Year's Eve. They passed a week apart of each other. I have cousins, and they have grandchildren that had to bury, parents and grandparents, two caskets. And their funeral happened to be on my uncle's liver transplant anniversary, the day that he received a liver, which would have been 7 years. So now it's become very personal to me. And I've prior to this happening to me, some in the community have come to get vaccinated because they have lost someone. But why does it even have to go that route, Why does it even have to, one is too many. The fact of the death rates, when I see it on the news, when I remember seeing when the first person had passed of COVID, it was like one was too many for me then. And so, now it's just really, really personal, and now I'm just really gonna just hone in on the underlying health conditions. and it's a lot of things we can do to keep ourselves safe and healthy. Mental wellness, diet, exercise, just really, taking care of ourselves. But this definitely took a toll, and it changes my whole perspective on what I do and my voice in the community now.
Yeah, and I am very sorry for your
Thank
losses. And as we're just closing out, for any of our listeners who might be feeling still hesitant about getting the vaccine themselves, what would you like to say to them or share with them? Anything?
I think one of the things, I have a friend who gives herself a direction, and she says, just do it. And that's my direction. It's almost just the same thing when I talked about organ, eye, and tissue donation. Is I tell them, just sign up to become an organ, eye, and tissue donor. Get the education about it, then just do it. Don't hesitate about it. Don't overthink it. Don't, oh my goodness, this is going to happen. This is going to happen. Just do it. The same thing with a vaccine. Just do it. Get the information. Talk to one of our vaccine vaccine navigators and everything, and just do it. Go to one of the events, and just march right up there and just do it. If you need somebody to hold your hand when you get it done, just do it. You're saving. You're gonna save. You're gonna make sure your community is safe. You're gonna make sure you're safe and everything. And you might save a life, and it might be your own.
Yeah,
that's a part of our billboard. Is we can do it. Like I said, I do this part-time, on the clock, or I'm paid part-time, but it's not part-time. It's sometimes I'm in the grocery store, I'm contacted by friends and family. If they need me, I'm gonna talk to you. So if someone approaches me and my vaccine navigators aren't available, Linda knows I'm stepping into that navigator role. I'm a navigator before I became a program coordinator anyway. So it's like a light switch for me. This is personal. I'm out there. I'm all about my community. So if they need me, I'm there.
And how can the community become involved with Motev and contact you all?
You can always volunteer with Cleveland Motev. You can contact us by going on our website, clevelandmotev.org. You can contact us at 216-905-2848. We always love donations. You can go on the site or you can give us a call. We are a community member with Community Shares. You can go on their website and get more information. We love volunteers. You might be interested in just volunteering with for our vaccine education program, or you might want to volunteer you might want to tell your story about being an organ, eye, and tissue donor. We are welcome. You are welcome to actually assist us in any way, shape, or form. But once again, clevelandmotev.org, or call us at 216-905-2848. Thank you so much for having us.
Thank you.
Thank you both for being on today.
Absolutely. Thank you.
And as we close out today, just a reminder of the contact information if you're wanting to contact Famigos. We're located at 1325 Ansel Road, and our phone number is 216-791-6476. You could also go online at famigos.org for more information or to contact us. And again, I want to remind everyone that there is the vaccine clinic on the 31st at the Famigos headquarters, and that will be at 11 a.m. And if you do have any suggestions for future topics that you'd like us to discuss on the community podcast, you can send it to marketing@famigos.org. Thank you.